Today we are going to talk about carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors, the drugs in that category is the acetazolamide. The brand name is Dimox. Now first of all we'll see the mechanism of action. Mechanism of action of carbonic anhydrase inhibitors. The CO2 and H2O from the tubular lumen diffuses into the tubular cell. From the lumen into the cell, CO2 H2O diffuses, okay, where there is a formation of H2CO3. There is a formation of H2CO3, that is a carbonic acid under the influence of enzyme carbonic anhydrase. Now this carbonic acid dissociates into H plus and HCO3 minus. It is dissociate into hydrogen ion and bicarbonate ion. Now bicarbonate ion transported into the interstitium, bicarbonate ion transported into the interstitium, the hydrogen ion exchanges with the luminal sodium with the help of sodium hydrogen antiportal. Now in the lumen, hydrogen ion combines with the filtered HCO3 to form the H2CO3. In the lumen, again hydrogen ion combines with the filtered HCO3 and there is a formation of H2CO3. This H2CO3 again dissociates into CO2 and H2 with the help of carbonic anhydrase, and this carbonic anhydrase which is present near the brush border cells. Okay. Now you understand better mechanism of action. Mechanism of action of carbonic anhydrase inhibitors. Okay. Now here you can see, here there is a CO2 and H2O. From the tubular lumen it will diffuses into the tubular cell. This is the lumen, this is the tubular cell, renal tubule, and this is the interstitium or blood. Okay. Now CO2 and H2O diffuses into the tubular cell from tubular lumen, where with the help of Ca, what is the Ca? Carbonic anhydrase, there is a formation of H2CO3, that is the carbonic acid. This carbonic acid is dissociate into H plus and HCO3 minus. H plus is a hydrogen, HCO3 minus is a bicarbonate ion. This bicarbonate ion is transported into the interstitium, into the blood, and hydrogen ion is exchanged with the sodium, luminal sodium. Okay, this hydrogen ion exchanges with the luminal sodium with the help of sodium hydrogen antipolter, and when this hydrogen ion combines with the filtered bicarbonate ion, again there is a formation of H2CO3. This H2CO3 is again split into H2O and CO2, and again that H2O CO2 diffuses into tubular cell from tubular lumen, and this cycle continues. But where this carbonic anhydrase inhibitor act? On this enzyme. These enzymes are inhibited, so that what will happen? There will be no carbonic acid formation. If there is no carbonic acid formation, then this hydrogen ion is not exchanged with the sodium ion. So here in the lumen there will be no formation of carbonic acid. This carbonic acid will not going to split into CO2 and H2O. Means, what is the mechanism of action? What is the main site of mechanism of action? The main site of action of acetazolamide is a proximal tubule, PCT, proximal convoluted tubule. It also acts on the collecting duct and proximal tubule. Most importantly, this acetazolamide is a non-competitive and reversible carbonic anhydrase inhibitor. It is a non-competitive and reversible carbonic anhydrase inhibitor. The important thing. By inhibiting this enzyme, it prevents the formation of H plus ion. It prevents the formation of H plus ion. right? It prevents the formation of H plus ion. As you can see here, it prevents the formation of H plus ion. There will be no H plus. If there will be no H plus, thus there will be no exchange of this H plus with sodium, luminal sodium. So sodium is excreted along with bicarbonate in the urine. Sodium is excreted along with bicarbonate in the urine. You will understand over here. Okay? Sodium will get excreted. Sodium will get excreted along with bicarbonate in the urine, because there will be no sodium hydrogen exchange. Sodium hydrogen exchange, because H plus ion is not formed, so it will not going to exchange with the luminal sodium, so that bicarbonate ion will not going to combine that hydrogen ion, and there is a formation of H2CO3. So all these things will be because of carbonic anhydrase enzyme inhibition. Okay. Now what happens in the DCT? There is an increased sodium potassium exchange. Why in the DCT there is increased sodium potassium exchange? Because more sodium is going towards the DCT, and that leads to the loss of potassium. More loss of potassium, because more sodium is exchanged with the potassium. So what will be the net effect? There is a loss of sodium, there is a loss of potassium, there is a loss of bicarbonate in the urine, that will result into alkalinization of urine. Actually there is a alkaline urine formed. Now where we use this acetazolamide? We use this acetazolamide in a glaucoma, because it is not used as a diuretic, because of very low efficacy. Because of very low efficacy, it is not used as a diuretic. Where it is used in the treatment of glaucoma. How come it used in glaucoma? Because it reduces intraocular pressure. It reduces intraocular pressure by reducing the formation of aqueous humor. By reducing the formation of aqueous humor, it is used in the treatment of glaucoma. This acetazolamide is used in the acute congestive glaucoma by oral and IV route. You can use either by oral route or by intravenous route. Or you can also use the topical preparations. Topical preparations like dorzolamide and brinzolamide. They come as eye drops. Dorzolamide and brinzolamide, they are used in the chronic simple glaucoma. They are used in the chronic simple glaucoma. Then apart from that, we can also use in the alkalization of urine in case of acidic drug poisoning. In case of acidic drug poisoning, for example barbiturate poisoning or salicylate poisoning, we prefer the alkalization of urine. We prefer the alkalization of urine. Then if you are gone for the trekking, like acute mountain sickness, in acute mountain sickness there is a dizziness, there is a headache, uneasiness. For the symptomatic relief and for the prophylactic purpose, it is used mostly prophylactically. The beneficial effect may be due to decrease in the pH and formation of CSF. Decrease in pH and formation of CSF. It is helpful in acute mountain sickness. If you are going for trekking, there will be headache, dizziness, uneasiness. All these are the acute mountain sickness. Acute mountain sickness. Now what are the adverse effects? Adverse effects of acetazolamide. There is a chance of hypersensitivity reaction. Sulfur containing compound, sulfonamide derivative, acetazolamide. So there is a chance of hypersensitivity reactions like skin rash, fever, nephritis. These are the hypersensitivity reactions are common because it's a sulfur, because of sulfur content. There is chance of drowsiness, paresthesias, hypokalemia. It causes hypokalemia, metabolic acidosis, headache and renal stones. There is chance of renal stones. Then it is contraindicated. Where it is contraindicated? In the liver disease, because there is a hepatic coma may be precipitated in patient with cirrhosis. There is chance of hepatic coma. in patient with cirrhosis due to decreased excretion of NH3, that is ammonia in alkaline urine. In alkaline urine, there is a decreased excretion of ammonia. So there is a chance of hepatic coma. So it is contraindicated in the liver disease. Then it is also contraindicated in the COPD, craniocorneal failure, or diabetes mellitus, because it can precipitate the metabolic acidosis or respiratory acidosis, which may worsen the COPD, which may worsen the CRF or diabetes mellitus. So these are the contraindication for the mannitol. Sorry, not mannitol, it's acetazolamide. It's a contraindication for the acetazolamide or carbonic anhydrase inhibitors. Thank you.